on families and socially. And next year will be the 10th year anniversary of Endo March. We encourage you to continue to participate in the activities by going to www.endomarch. If you go to www.endomarch, you can download the previous webinars that we have addressed many issues, including diet, including health, including different organs involved with endometriosis. That webinars, it is on www.endomarch. Also, Worldwide Endomarch has an app that it is completely free. We donated it to the Worldwide Endomarch. It is called Nezhat Endometriosis Advisor. Nezhat Endometriosis Advisor diagnoses endometriosis with more than 94% accuracy on patients that they have endometriosis, and also they want to have children and they have not had children, and it is they have no or unexplained infertility. So Endomarch and Nezhat Endometriosis Advisor, that we can get that app for free from iPhone and also Google, Android. You can download it. So again, we like to thank you for your participation. And we have an outstanding guest group that Dr. Ceana Nezhat would proceed and introduce them. Dr. Ceana Nezhat.
Thank you very much, Dr. Cameron, and greetings from Atlanta. Years ago, Dr. Keren Hood mentioned endometriosis is the whole body disease. For years, we have been publishing, talking about surgical management, but realized that endometriosis could affect the entire body. And one area is the psychological impact and effect on the social condition of the individuals. If somebody has diabetes and tells people I have diabetes, they say, okay, if I have leukemia, it's okay, and they have all the sympathy. If somebody says I have endometriosis, they just throw their eyes up. And endometriosis could cause unseen scar on the mental and social condition of individual. So having that in mind, we thought on this session, invite a group of a panel, that outstanding panel. I am so grateful for them to volunteer their time. We have Nicole, who would share her story. We have DeeDee, who would have the child psychologist and therapist. And we have Dr. Minal Shah, which has extensive experience on dealing with psychosocial impact of the individuals. So what I like to do is start asking Nicole. I'd like to ask Nicole to start, tell a little bit about her story. And this is really informal. We just want our viewers around the world understand that awareness about endometriosis is number one, a step towards proper management. So Nicole, it's all yours.
Okay, thank you so much for the introduction, and thank you for having me on. Endometriosis is something that has affected my entire life from the time I got my first period. It's been a rather long journey, and so I'll try to condense it to the highlights of how it affected me. But it did affect me physically, emotionally, and mentally. And so I've spent many years trying to figure out the root cause of my many health issues. And it was quite a relief to find out that it stemmed from this one place. But my journey with endometriosis really started when I got my first period at age 12. The pain each cycle was pretty excruciating. I would have really bad lower abdomen pain, really bad back pain, and it would shoot down to my knees, and I could feel it in all my joints. So that's how I knew I was going to get my period soon, is that I had joint pain. It would shoot down my legs. And then ever since I can remember, I had really debilitating anxiety. My anxiety was out of control, especially in middle school. I went through a period where I couldn't even leave my house. I think I was in 8th grade, which is kind of old not to leave your house, but I couldn't socialize. I couldn't go to school. It was horrible. My mom would have to drag me to school kicking and screaming like I was a little kid. She's doing the best thing that she thought for me. The doctors were like, the best thing is to, get her on Zoloft and her to go to school, live a normal life. So in 8th grade, I would just go to school and I would sit in the principal's office all day just because I couldn't talk. I couldn't interact with people. It was pretty all consuming. And then going into high school, I significantly changed my lifestyle and diet. I was always really into exercise and sports. That seemed to help tremendously, but it was still always there. My anxiety was always lurking behind me. I was able to be more social, but I had trouble, spending the night out just because I didn't know when I was going to experience pain, when I was going to be physically sick. And then they put me on Zoloft. It was still a constant struggle. And then in high school, I started experiencing depression. It would come like a week before every cycle. And I don't remember it impacting me socially. I definitely didn't go to everything I would have. But it was something that people probably didn't want to be around me that week because I was extremely moody, irritable, and just would want to shut down and crawl into my bed and turn off the lights and not come out till it was over. And then in my mid-20s, I started getting extremely bloated and experiencing tremendous weight gain, and nothing was helping. It was getting worse and worse. I felt so swollen. I felt so lethargic. I am a runner and I work out pretty much every day, and I couldn't work out. It was just, my body was weighted down. I was just so tired. And I actually gained 30 pounds in a summer, whether that was weight and bloating, I don't know, but I was swollen head to toe. And then in just a little over a year, I went from a size 0 to a size 12 in clothes. So the whole thing of not wanting to go out, not being social. I mean, I couldn't wear my sweatpants out. Nothing fit me. I was constantly shopping, even the biggest sizes, I was bloated in weird areas, nothing fit. So that took a toll on me. It was very uncomfortable. And then it got to a point where my body weight, my depression came to a head, and then I needed serious medical attention and really needed help. So I saw many doctors. They all tried to help with my symptoms, but not find the root of it. So I went to one doctor and talked about my weight gain, and they tried to put me on Vyvanse or tried to put me on a stimulant. And I was like, but why am I gaining this weight? Why am I so depressed? What's happening to my body? I have no control over my life right now. And then I went to a nutritionist in Atlanta. She's really, really good. I was explaining my symptoms to her, and she said, it sounds like you have PCOS. So she introduced me to Dr. Ceana Nezhat. I made an appointment with him. We had a long conversation. He wanted to know all my history, everything that was going on with me, not just physically, and it wasn't isolated to my body. It encompasses my mind, my emotions, how I was feeling. So after talking and doing the examination, he did diagnose me with PCOS. And then based off that, he thought that I really probably had endometriosis as well. So in October 2019, he did my laseroscopic surgery, and he diagnosed me with stage 4 endometriosis. And ever since that surgery, I see him every 6 months. I've been just doing so well. I have a really good workout routine. I've never had more energy than I've ever had. He put me on a hypoglycemic diet. He introduced me to Dr. Minal Shah, which is my therapist, who has been a significant help as well, to getting me back on the right track. And it's the first time in my life I feel like I've ever had control over my body, my mind, just feel completely stable in all aspects. And even my friends and my family, they're like, I don't know what happened to you the last 2 years, but you seem like a very different person. And I've always had good relationships, but I feel like it's just impacted my friendships and my relationships with my family even more, because I just feel like I have the energy. I've learned to love my body and everything that comes with it. And I think it's really important to take the time to find the right doctors. They're in a network, so they're going to introduce you to the right doctors and have your best interests at heart. And that's really, really my story.
Nicole, thank you so much for sharing your story, and very happy to be part of your journey, and you are doing so great. So stay with us, we will come back. So on that line, as you notice here, Nicole brought up a great point out that actually on the books that we published, and we have some patients have written their story, Dr. Minal Shah has a chapter. We have looked at the whole body, and we call it the comorbidities associated with endometriosis. And for example, nutrition, physical activity, holistic therapy. So having said that, how would this affect our daily life and how we become a messenger, not only about our own health, paying it forward, and when on our daily activities, when we deal with the family members, oh, I had similar symptoms, so you may have endometriosis, like Nicole mentioned it. She talks to her family members. So I'd like to invite Dr. DeeDee Chackel. She is a child therapist, and DeeDee, are you with us? Tell us about you. She is very well educated and having a center in San Diego. And DeeDee would tell us her story.
Well, first of all, Nicole, beautiful, beautiful explanation, and how brave you are to share your story. And thank you to the Nezhat family for including me in this. This invitation has really given me an opportunity to reflect on my personal journey and kind of see how it has impacted my life and my career choices and who I work with now. I'm a school psychologist at a little private school down the road where my twin daughters attend. And so my medical history is not as complicated as yours, Nicole, but there's definitely the same theme that you can see, running through all of this. I started my period in middle school. It was immediately very heavy, very painful. And then it became increasingly irregular. And so, very difficult to manage. So I would say in high school that I had a great family, great parents. I could talk to them. And so my mom took me to a gynecologist and they put me on a birth control pill to regulate my periods. And I think that was about in 9th grade. It could have been a little later. And that helped for a while, got me through college. And, but you kind of normalize the pain, you kind of normalize all the, what ifs during the time that you're menstruating, and what if it's going to be heavy? What if it's going to start early? What if it's going to keep going? There'd be times where I'd have 2 weeks, So, but you just kind of normalize it and live with it. And it wasn't until I would say the mid 90s, when I entered graduate school, that the pain became really increasingly unbearable. And I would say I was having a specific sharp pain on the left side of my abdomen and the uterus area. And so my gynecologist did an ultrasound, and they found a dermoid cyst on my left ovary. And this is prior to meeting Dr. Nezhat. And when they went in, they tried to do it laparoscopically, but ended up having to do an incision. And they found, very severe endometriosis and the polycystic ovarian syndrome and all the good stuff that explains a lot of symptoms leading up to that. And that is what prompted me to seek an expert. At that time, I was really concerned about fertility. I wanted to have children. I wanted to be a mom. So that is what really got me to Dr. Nezhat. And, I've been a client for 20 years, over 20 years. I've had three surgeries in total. But when you talk about the psychosocial impact that had on me, now reflecting on what I've been through, the pattern of the three things come up: pain, persistent pain, low energy, and fear. And the fear is, you can kind of attribute low energy to sort of depression symptoms, but the fear was really something that I think goes unacknowledged for such a long time, and that can really have a major impact on, prognosis and life choices, and just living a healthy, happy life. So in my 20s, when I was given the diagnosis, there was a lot of relief because that explained all the psychosocial things that were going on, and since I had started my period. And then it helped me to understand and predict how I needed to go forward. So, the fear is obviously contributes to anxiety, high anxiety. I was put on medication in high school, which, was more unusual than this nowadays. It's a lot of medicated people, a lot of medicated teens, a lot of teens needing some extra support, but it was unusual in the 90s, late 80s. And so, but it's the fear of being unprepared, that I was going to start my period when I didn't, wasn't prepared. Fear of, as a younger child, leaking on my clothes, being at school and having that, what if the boys see, or what if, something happens and my mom has to bring me another uniform, and it transitioned to, I did struggle with some bloating, some cystic acne, and so fear of a breakout, right before prom, or fear of those kinds of things, and fear of weight gain. Am I not going to be able to fit in my clothes? And all of that, kind of persisted through college. And then it was fear of not being able to have children. And that really put me over the edge of worry and concern and anxiety. And then along with that, it was the fear of, what if this turns into cancer? What if it turns into some kind of pathology that is going to affect me going forward? So having the right person, the right diagnosis and the right caregiver is so critical to maintaining your mental well-being while you're going through such a, you're having all these whole body symptoms, like you said. Just it's affecting multiple areas in your body. It's affecting multiple systems. So all of those things, it's really interesting in retrospect, to to see how that impacted even my career. I knew I wanted to go into psychology. I knew I wanted to work with kids, and even impacting me as a mom. I have two amazing twin identical daughters who are 17 and they're seniors. And the irony of this entire thing is they are not my birth children. So as much as I wanted to, I was so fearful of not being able to have children, I was blessed with these two amazing daughters that that I didn't, have to go through all of the fertility treatments and what I potentially could have gone through given my diagnosis. So I'm thrilled about the increased awareness because that contributes to increased early intervention, and then obviously prevention of other issues that develop as long as you live with this disease. So that's my story. I still come home annually. I'm in San Diego. I come home annually to see my favorite doctor, and he knows my whole family and he's met my girls. And so what a blessing it is to have this increased awareness and prevention.
DeeDee, thank you very much. I appreciate your candid sharing your whole journey. And DeeDee always says, I will watch my two daughters and everybody that I deal with at the school like a hawk. And
Oh, yes.
I wouldn't write off any of their symptoms. So stay with us. Let's invite Dr. Minal Shah. I've had the pleasure of working with Dr. Minal Shah for more than a decade. And what I realized about Dr. Shah, the same thing that I mentioned, she looks at mind and body together, the whole body disease. Dr. Minal Shah is the founder of the DBT. When I was talking to some of my patients, referring them to Dr. Shah, I said, she's the founder of DBT in Atlanta. They said, what the heck is DBT? It's interesting. At the University of San Francisco, they actually have the DBT center also, and one of the therapists has put something online, exactly the same title. What the hell is DBT? So I would refer you to that. It's funny, but it explains everything for you. On that line, I'd like to invite Dr. Shah to share her knowledge, expertise with us. Minal?
Thank you. Thank you so much for having me, and good afternoon, everybody. One of the things that we've noticed in the last over 20 years of practicing various forms of DBT is that many females, more than not, have had an onset of psychological symptoms in the 12 to 18 months pre-menarche. And a lot of the females have a severe worsening of symptoms in the 7 to 10 days prior to their menses every month. So it came to mind that it couldn't possibly be that people were just developing severe psychological symptoms, at the onset of puberty for no reason whatsoever. And the type of patients that we see, generally speaking, have parasuicidal behavior. They're cutting, burning, binging, purging, drinking, using drugs. They're very severe behaviors that can often lead to active suicidal completion, inadvertently even. So we started sending most of our females to Dr. Nezhat, who I will absolutely say, beyond a shadow of a doubt, cured them. Upon alleviating most of their reproductive and endocrine symptoms, our work was cut down by a good 50 to 75% with each of these patients. So all of the patients that we have sent to Dr. Nezhat that have completed a solid year of treatment with us have gone into remission, most definitely in the psychological arena, but for the most part, from what I'm hearing, with their reproductive endocrine difficulties as well. So we are just so thrilled that we have a resource like Dr. Nezhat in our city, where we can send everybody one after the other. The vast majority of our practice does go to him. And I dare say that we have one of the absolute highest rates of remission and cure for the patients that come to DBT than of anybody. And I think it's because of him and the work that he does.
Minal, thank you very much. Can you elaborate a little bit more about what DBT is, what your center, and I mean, you give lectures everywhere I see it. So for the general knowledge, I think it would be helpful if you elaborate a little bit more about the focus of your work and how, in general, you deal with the individuals. Yes, I get involved with the female part, the patient part, but you deal with their families also. So please elaborate on that if possible.
So dialectical behavior therapy was developed for the emotionally dysregulated patient that wasn't responding to other treatments. Patients that are pervasively emotionally dysregulated and patients that are pervasively emotionally lonely and shut down and non-functioning. So we have two sides of the same coin. Those with very big behaviors that are creating chaos in their lives. And we have those patients that are extremely shut down and not living their lives. Two different sides of the same coin. The DBT and RODBT really treat the patient through a set of modules that are skills-based. These are disorders that we are treating that are due to a lack of skills in coping, in functioning, in relationships, in work, in academia, in all areas of their life. So the great thing about DBT and its counterpart, RODBT, is that we teach skills on a weekly level, a weekly basis, one skill after another, building from the ground up, bit by bit, and it's incredible as an outpatient therapy because they learn something each week that's very tangible, and then they go home and they practice that, and then they come back the next week. And the efficacy of DBT has been shown to be extremely effective at the 12-month mark, a solid year of shaping behavior in, a solid year of shaping unwanted behavior out. Most of our patients do extremely well at the 1-year mark, unless, of course, they are fighting their biology, which is where Dr. Nezhat has typically come in for us. Predominantly, most females, most of the patients that come to us are going to be female. Most males with the kind of difficulties that our females have, generally speaking, land in jail because anger for men is very explosive, and anger for females is generally turned very much so inward, right, in terms of self-destruction. So the predominance of our population is going to be female. And what we've noticed is that psychiatry as a whole has been just treating the symptoms day after day, year after year, decade after decade, just putting people on antipsychotics, antidepressants, mood stabilizers, and not really looking for the causes of what's going wrong with them. What I really love that Dr. Nezhat just mentioned is the holistic approach. DBT addresses that. We have a skill called the please skills, or what we call the my seed skills, sowing the seeds of health. And it stands for SEEDS, sleeping, eating, exercise, drugs, illness, medications. These things are what we look at holistically for each and every patient. So it's beautiful that we have a treatment that does that and tracks people's emotions in regards to what they're doing every day, the skills they're practicing every day, as well as their nutrition every day, as well as their cycles every day. This is a very comprehensive, broad, all-inclusive treatment that has complete efficacy behind it. And I love that. I love that. most of our folks are able to get off the vast majority of medications as well.
Thank you. Thank you very much, Dr. Shah. So as you notice, so we are talking about connecting the mind to the body, and eloquently, Dr. Shah mentioned it. And if you notice, we are talking about replacing behavior therapy or cognitive therapy with just simply throwing medication to the other medication. So Nicole beautifully explained this, put her on Zoloft, and they wanted to change it from one to the other. But her bloatedness, it was completely independent of her psychological effect. It was the bloatedness who was leading to her mood disorders or psychological impact. There is a condition called endo belly. You may want to look it up. It's interesting. It's kind of rare, but it happens. And endo belly is a direct effect of the endometriosis and this bloatedness. And interestingly, I was in American Fertility Society meeting, and I was talking, giving a seminar. And when I asked people, these are all physicians, reproductive surgeons, or reproductive endocrinologists from around the world. We had about 200 audience. And I asked them, do you know what endo belly is? None of them knew that. So look it up, especially I'm addressing this to our audience, the people who notice it. Endometriosis could cause bloatedness. And bloatedness is not because you decided to, out of a sudden, to gain weight or juggle on a cake. No, it's endometriosis. The weight gain could affect that. So tell me a little bit more, Nicole. You have a brilliant nutritionist, which I have her know, and she knows about hormonal aspect, what do they call it, gluten intolerance, lactose intolerance. Tell us more about how this nutritional change in your life has impacted, and your knowing about your endometriosis has impacted your daily life.
Yeah, so when I was 15, I saw that same nutritionist, and she modified my diet to exclude gluten, dairy, soy, and egg. And I noticed a tremendous difference. Just more energy. I mean, not completely better, just more energy though. I wasn't, I was sick a lot. I'll spare you the details, but stomach wise, from what I was eating. So that helped a lot. And then when I started getting extremely bloated and the weight gain, that's when I really got very frustrated, because I was eating so healthy, so clean, gluten-free, dairy-free, soy-free, egg-free, very whole foods. And then when I saw the nutritionist again, I was like, I'm gaining all this weight, I'm working really hard, and it's just very discouraging because I'm going in the opposite direction. And I mean, I can't live my life like this. And then when she referred me to Dr. Nezhat, one of the first things he had me do was sit for a glucose test. And what the glucose test showed was that I'm actually hypoglycemic, which is linked to my PCOS. And so once I shifted my diet and shifted my lifestyle to incorporate a hypoglycemic diet, which is, you can eat very healthy, but everybody's different. So it depends on how you're going to respond to the food and how you're going to break down the food and absorb the nutrients. So when I switched to a hypoglycemic diet, it really changed everything. It gives me so much more energy. I feel like I have control over my weight, my bloating. It was hard for me to make plans before that because I never knew what days I would be extremely bloated and when I could or couldn't wear clothes. So it was hard to have a schedule. My friends always used to joke around with me because I would only make one plan a weekend. I couldn't have more than one plan a weekend because it would wipe me out. I couldn't go to dinner 2 nights in a row. I just couldn't have a normal social calendar for someone, a young single female. And so now I feel like my social calendar is bustling. I have so much energy. I can have plans every night of the week and just stay on track. I don't have to be so regimented and type A about my environment and my schedule, because changing my diet to hypoglycemic diet has changed everything, along with the surgery and then the weekly help from Dr. Shah as well.
Great, well, thanks. So in addition to changing the lifestyle on eating, sharing your issues with somebody like Dr. Shah, a counselor, a knowledgeable person who knows about the whole factors, not just to a therapist who would, or a psychiatrist who just wants to change one medicine to the other. Talking to somebody who knows about this background, don't you think it's been more helpful than the people you talked with before?
Yes, absolutely. I mean, I've seen multiple different doctors for each symptom, and they were all just trying to give me things to mask the symptom and reduce the symptom, but no one was really taking a holistic approach of looking at the whole body. So having doctors like you and Dr. Shah, someone that looks at the mind and the body and how it's linked, has been a tremendous differentiator in my life. So thank you.
Thank you, Nicole. So the take-home message from what Nicole says is, take no for an answer. If they tell you it's in your head, it's not. If they want to put you from one medicine to the other, my compliments to her. She changed nutritionist until she found a person with knowledge. She changed doctors until she found somebody who could take care of it. And she gets the therapist. So if somebody is doing the same thing for you and you are not getting the results, it's always good to get a second opinion. Having said that, we go to DeeDee. DeeDee had the same experience. Tell us what you think.
Oh, I think it has been the amount of relief when you keep searching and you get the answers and it all makes sense. All the puzzle pieces are put together, and then life feels much more manageable, and you have the people that you know that you can depend on, because at least that part you can control somewhat. You can control who's in your life and who you listen to, and make sense of, help make sense of what's going on with your symptoms. And when there's so much other things in this world we can't control, and especially the kids today, the teenagers that I work with, they have so many stresses and so many different things that I never had to deal with social media and all of the different stresses that go along with being a teenager now. It's so hard. So definitely there is hope, and this increased awareness, I think, is going to change the trajectory of a lot of people's lives, as far as preventing that place that you can go to that's so dark, and it's medication after medication and after medication. And so again, the increased awareness just leading to prevention of these things is just fantastic.
Well, great. Thank you, DeeDee. DeeDee brought up a great point out, and I've heard it all the way. It says verbalize and vaporize. So DeeDee mentioned one important point. A good relationship with the family and family members, not holding it in or stuffing it, it's not good. Talking with family members and educating the family members. One thing is unique about family, DeeDee's family. She said it, she's open-minded, her family, they spoke together, and actually her godmother, her mother's best friend, who knows where I live,
Yeah,
actually called me.
she did.
She said, I want you to see DeeDee because she wasn't getting better.
Yes.
So that was a great point you brought up. Ask for help. Don't stuff it in. It really becomes an old scar. And talk to your family, talk to your friends, and look for help.
You
Dr.
just
Shah
normalize
brought up, go ahead, go ahead.
Normalizing pain, normalizing this bloating and weight fluctuations and horrible breakouts and just pushing through. You don't, that is not, it's not normal. It's being okay to say, I don't think something's right, can make such a dramatic impact in your future and in your life.
So when you talk to the children you deal with, you are looking at them and you lead them to the direction and you bring it up. So it affects your daily work also, doesn't it?
Yes. And it's funny, we have some fantastic teachers, and I just had a conversation last Friday with one of our kindergarten teachers and she was explaining some symptoms and what she's going through. And I said, oh my gosh, I think you better explore, this option. Maybe you have endometriosis. And and then one of my dearest friends and colleagues at work too, she was worried about her daughter. And I was like, wait a minute, this sounds a lot like endometriosis. And so even with, it's not just affecting the kiddos that come into my office, it's also my colleagues and, seeing the younger teachers start to struggle with things in their, child birthing years and then child rearing years. So it's been, such a huge blessing to me to have the right people that have educated me and have taught me how to manage my symptoms, and through diet and exercise and supplements and therapy and just talking to the right people. And it's possible. I'm very healthy. I feel great. I come home, I go home every year and I get my fix and I get my physical and I'm in Atlanta and I see my family and I see Louise Poor and who got me to Dr. Nezhat, and it's great, but just keep searching for the right people.
Thank you again, DeeDee. And Dr. Shah brought up a great point out, which is very important. She mentioned the male, they have different type of behavior than the female. And the female, they become more internalizing it and they become more self-destructive. This is a great point. We have to look at it. She mentioned different manifestation of self-destructive behavior. One of them could be eating disorders, eating the wrong food, or other aspect. Dr. Shah, this is a great area, and I think we see it very often on our patients with reproductive disorder, mainly endometriosis, fibroids, the hormone imbalance, etc. Could you please elaborate on that?
Absolutely. One of the interesting things that we've really noticed as of late is with anorexia, which of course has the highest mortality rate in all psychiatric illnesses, with bulimia, with sleep disorders. Of course, sleep disorders are the #1 indicator of whether or not you will achieve remission in psychiatric illnesses. One of the things that we've noticed is obviously all of these things are driven by hormones across the board. I'm not just talking about reproductive, but hormones in general, correct? So, correct, right, Dr. Nezhat? The body is run by hormones.
That is correct. There is a direct relationship between the hormones and the physical conditions. So we know, for example, the pituitary controls the pancreas, the adrenal gland, the ovaries, the thyroid. We call it, these are all associated disorders, and one leads to the other. You are absolutely correct. Please elaborate.
And one of the things that we noticed is, and I'll give you a very, very benign example, is if somebody was drinking too much orange juice with vitamin D and they were not sleeping well at night, they might not know why they're not sleeping at night. And now we're giving them sleeping pills, and nobody's taken a history as to why they're taking so much vitamin D into their body. And of course, vitamin D is activating, right? Not sedating. And we know that, but people don't know that in general. So one of the things that we'd really like to see is with every disorder that comes in our world, be it everything in eating disorders, be it anything in personality disorders, be it depression, we would like a full endocrine workup, not just reproductive, but a full endocrine workup, head to toe for every single individual, because we see that even in males, they often have an undiagnosed endocrine difficulty. I mean, I know we're here for endometriosis and PCOS and fibroids, but the fact of the matter is that this is all endocrine driven, hence these wonderful gentlemen are reproductive endocrinologists. But I would like to expand this awareness to all endocrinology, the greater umbrella under which most things are occurring. And most psychiatric diagnoses are diagnoses of inclusion and not diagnoses of exclusion. So once somebody sees 1 or 2 or 3 symptoms, they say, oh, she's got major depressive disorder, and starts throwing pills at it. And nobody really looks for the cause of what's going on. Nobody really looks to exclude any symptoms from a diagnosis. And I think that really very much needs to happen for both genders, to be very honest, in order to adequately treat patients.
It's a great point. And remember now, when we talk about gender, it has become more, I would say, common now that we have transgenders.
Yes.
And we just can't focus just on the female part. And that could affect the individual. So we have to validate, as you mentioned, the hormonal aspect, regardless of the chromosome. We have to look at the whole area. And that was a great point you brought up. And
we have watched several trans men, people born biologically as female, have many reproductive difficulties, from PCOS to PMDD to endometriosis, that have, through very significant emotional difficulties, made the decision to transition to being a male. And unfortunately, that doesn't get rid of the problem that is causing the emotional dysregulation in the first place. Okay. So I really think that a heightened awareness for individuals who are trans male is really warranted in the reproductive endocrine communities.
yeah, and I believe you see quite a number of those, don't you?
We do.
So this is a great message to send it across, that when we are talking about, again, going back, that endometriosis is a whole body disease. It not only it could affect the XX chromosome, it could affect, change regardless. And we have the opposite too, that if the male wants to convert to female and they give them high amount of estrogen, for example, to convert them, that could impact the cells, embryological cell that they are in the body. On the book that we wrote on adolescent endometriosis, we have a chapter that did an autopsy on the fetuses, and they found out that they had endometriosis cells on the preborn fetuses. So if we need to be aware of it, that if we give these people hormone, it could impact their physical condition also. And today we actually have some of our fellows participating. It's been a greatest discussion. Please stay. We would like to have you the last message you'd like to give across. But before we go there, we want to see if any of our fellows who are online would like to give some point. I see Keren is on, Keren Hood. If I see her, maybe there are more on. I'd like to welcome you and get your opinion about this. And this is Dr. Deadmond. She is my fellow also. If you'd like to say something, you are welcome to do that. Amanda, you are muted.
There we go. Hi, thank you so much for sharing your stories. It's been really enlightening to hear from people who are affected and people out there treating our patients with endometriosis and addressing, not just the medicine of it, but also, the full body and not just the surgery. And so that's been really great to hear. I appreciate you all. And I think it really goes to show how important it is to start early in addressing these symptoms because, Nicole, you suffered for such a long time before you were able to find relief and to educate people. And is the purpose of this today is to educate people and try and get more people involved in seeing this early. And so I think that's been great.
Thank you, Dr. Deadmond. Keren, are you there? You'd like to say something? Okay, so having said that, before we pass the podium to Dr. Keren Nezhat, I'd like to ask Nicole, DeeDee, and Dr. Shah, give us your take-home message. What's your message before we finish?
Mine would just be to listen to your body, and just because someone is a professional, if it doesn't feel right and it feels like you're just a number to them, keep searching for doctors that are going to take the time to listen and sit down and call you at home and go over the results that you have, the good, the bad, the ugly. You don't have to be dying to have time out of their day. So I would just say, follow your gut, listen to your body. If someone's telling you that you have something and it just doesn't feel right, or if you're not getting the proper treatment or time of day from your doctor, there's other really good doctors out there that are gonna search to find the root and really make you better from the inside out.
Nicole, thank you so much. I know you were busy and really had to get this done on your schedule. So on behalf of all the people who watch, I really want to thank you for volunteering your time. DeeDee, your turn. What do you think?
I would agree with Nicole. Just speak up. Don't lose hope. And to really try to seek somebody that if they are not aware of whole body treatment, that they can get you to somebody that can put the whole puzzle together for you and support you in that way, and as opposed to just being so narrowly focused on, hormones or depression, or so narrowly focused on one symptom, because again, it does affect your whole body, and that there is hope, and that you don't have to push through all of the pain, and you can have babies, and you can feel great, and you can have a full life, even with this, and managing this is possible. Yeah, so, and thank you for having me.
Of course, DeeDee, thank you so much. I know busy mom and busy work and wife, and is putting it in your schedule. I'm really grateful.
Oh, I wouldn't miss it.
Thank you. And Dr. Shah, I know you had to cut your travel short to be here, and I'm really grateful for all you are doing for all these patients and for all you do everywhere. But we'd like to hear your take-home message.
Well, first of all, my gratitude goes both ways. My patients come crying to us with relief because they have finally met you and finally have a solution in sight. My take-home message really has two parts to it. One, to patients, we are the one field of medicine that is paid to listen. And if you don't find somebody that knows how to listen and put all the pieces of the puzzle together, don't spend years with that person just describing your woes week in, week out with no relief in sight. For the professionals, what I want to say is, again, we are the field that's paid to listen. And unfortunately, the field of psychology has not been educated well enough to know what to listen for. So I believe, and I've noticed this in my trainings across the state that I'm doing for all of the hospitals, that almost every clinician that graduates as a counselor or psychotherapist has no idea of what to look for any illness, much less reproductive illnesses, for all of their patients. And as I'm teaching them about medicine and endocrinology and sleep disorders, their eyes are opening up very wide, and they're like, we have never considered all of these things. And they start coming up with multitudes of patients that they realize could have been helped much more effectively, much sooner, had these things been addressed. So I would like the move to be made, the push to be made for clinicians to have a more well-rounded education, because being the field that is paid to listen, we need to know what we're listening for.
Great, thank you so much. And one thing you brought up, and I really want to take this message to all the therapists, that you said we have to get away from inclusion, diagnostic inclusion. We have to also focus on exclusion. And that's the key factor. Really, that was eloquently said, and I like to echo that. So I'm so grateful to all the panelists for taking the time for being with us. And I like to thank everybody around the world who is listening and taking this message forward. And we'll pass the podium to Dr. Keren Nezhat, the founder of Endomarch. This was his idea to start this, and Keren, all yours.
Thank you very much, Ceana. So this was a fantastic session. We thank you and all of your guests. Every one of them was better than the other, and the information was very, very helpful. I have no doubt that more and more people will continue to look at this and view this, and would be very helpful to the participants. And we thank all the participants for their interest, and all of you around the world for Endomarch. And we look forward to your participation and your activity to put an end to the dynasty of endometriosis. More and more good news every day is coming. Since the worldwide Endomarch, the awareness started 10 years ago, and endometriosis is being recognized, more publications, more diagnostic tests. So we thank you, and we look forward to the future session. Also, I thank all the people at the Worldwide Endomarch headquarters, Barbara Page, Zoe Pennington, and all of the assistants. I don't want to name one by one, Melanie and Michelle and Leslie. I don't want to forget many, and we thank all of them. We appreciate it. We look forward to seeing you. And thank you very much, Dr. Ceana Nezhat, and all of your guests. Thank you. Bye-bye. Forward we go.
Forward we go. Thank you very much.
Thank you.
Bye-bye.